Hey Society. I mean, we all know that we are prescribed a lot of medications that we might be able to get off of from what you're teaching.
Right.
Eating better, staying healthy. So that's a great feeling when we can do that.
Right, right. Now, is there like a directory where people can go to find out people who are like you, who have been trained in these areas, if people have these problems?
Yeah, the Las Vegas Institute, I think it's lvilive.com. lvilive.com.
Okay.
If you can't find it that way, just look up Las Vegas Institute. And they are the foremost when it comes to teaching about neuromuscular dentistry, and they should have a list of basically all dentists who have trained there and learned. With the centric relation or Pankey philosophy, I don't know their website, but I'm sure you could get on Google and just look up Pankey Institute, and that they would do the same thing. So either way, if you're looking at any doctor that's taking this type of training, you're looking at a guy that's gone way beyond what dental school teaches and is really trying to learn the very best and provide the patients the very best. And I don't think you can go wrong with a dentist like that. Is there any other questions on clenching and grinding in TMJ?
Hang on, let me just check real quick. Someone was asking if there's a slide or a picture to see the appliance.
You know what? I did not include it. There's a couple different appliances out there. The main one is going to cover either your top or bottom teeth. It's made out of an acrylic material, so it's very hard. The key to it, because in the beginning you could go to a drugstore and buy a mouth guard, put it in between your teeth, and it's going to work. The problem with the mouth guard is that it's soft, so over time your mind starts to realize, hey, I've got something soft in my mouth, and so this is something I can chew on also. And something soft, you can potentially dislocate your joint at that point in time by putting so much stress on that chewy appliance. So it needs to be something hard, and then the key to it is the dentist needs to create the perfect bite on it. So every tooth needs to hit that thing evenly and create that perfect bite, so we're quote-unquote fooling the mind to where it's not trying to do it itself. Does that make sense?
Yeah, yeah. So someone was asking, I guess you've already answered that, but she says, how do I know if my dentist knows about neck pain being connected with my teeth and knows what to do? Are most dentists aware of this?
I hate to answer this question, but I'd have to say that no. Most dentists are not aware of this. It's not something we're really taught about in school. Some schools will touch on the subject, but not go into the depth that they really need to. I would look at, you can always ask the dentist, ask about his credentials, just ask about your neck pain. If he doesn't put any correlation to it, he probably has never received the training and just doesn't know. And I hate that that's out there, but it is true. And so these are the two places really, and these are the two philosophies, the centric relation and neuromuscular approach. And the reality is they don't like each other. So one's going to bash the other. And luckily I've had training in both, and I think they're both right in certain cases. But asking your...
Isn't that funny? Isn't that funny how almost every field in medicine you're going to find different opposing forces, fields, all attacking each other. It's just amazing.
Yeah, it's always going to be that way. This is one, but this isn't near as bad as the amalgam and silver fillings that we're about to talk about. That has been a heated debate for a very long time.
Wow.
But I think this right here, of course, we talked about periodontal disease, gum disease, and how it's linked to the body. This right here, I think, as more and more dentists learn it, is going to become huge in dentistry. The idea that I can get patients off all these pain medications and prevent surgeries and everything else is going to be probably the big breakthrough in dentistry, 10 years down the road, when more know about it.
All right, before we move on, tinnitus, or is it tinnitus? How do you pronounce that?
Tinnitus, ringing,
tinnitus.
yeah, ringing in the ears.
Is that connected to TMJ, or are you getting to it?
Yeah, it can be. So we were talking about stuffy or ringing ears earlier. That's one of the signs and symptoms. A lot of times a person will go to their ENT, they'll look, and they won't see any sort of problems or inner ear infections or anything else. So the temporomandibular joint itself sits right up next to the ear canal, and as it gets inflamed, you get that stuffy, ringing ear feeling. And so a lot of times it is related to TMJ.
Got it. Okay. All right. I think we can move on.
Okay. Ms. Chichen Itza, outside Cancun, Mexico. All right, so the last thing I want to talk about here today is going to be amalgam or silver fillings. And as I previously mentioned, there has been a tremendous amount of debate about this product in the dental community for years now. And if you want to see arguments almost like politicians throwing fists, this is the subject in dentistry where it's going to happen. I want to start with my thoughts on amalgam. Amalgam is 50% mercury, and from that standpoint alone, I don't think the product should be used anymore. This mercury is leaking out of the filling. It is increasing the amount of mercury in your body. We all know that mercury is a poison, so why would we want this in our mouth? My thought on amalgam is that it fractures teeth. It is a metallic material, so it expands and contracts with heat and cold. So when you have it set inside of a hole in a tooth and it expands, it puts pressure on the natural tooth, causes it to crack, and then part of the tooth breaks off one day when you bite down, and it leads to a lot of unnecessary dentistry from crowns, root canals, and you potentially could lose the tooth and end up needing implants, bridges, and just a lot of unnecessary stuff. And last but not least, it leaks. So I've been taking silver fillings out for 12 years, and it's never ceased to amaze me how much cavities we find underneath them. And I always said that under about 80 to 90% of them, I found cavities. Makes sense. Again, it expands and contracts, so it pulls away from the tooth, and you get these gaps, and this microscopic bacteria gets underneath it and starts a cavity. So the big debate, and I just think it shouldn't be used anymore. So the big debate from the American Dental Association, what was their thoughts on amalgam? In their defense, what they always said is that it's a product that has been used for over 100 years with a great track record. Well, that's great that we're still using a product that's over 100 years, but I think we've advanced a little bit in the meantime.
Mm-hmm.
It's inexpensive and can be placed in a wet environment. This is the comment I hear by most pro-amalgam dentists. It's just cheap, so they like that, but when we're doing any restoration, we want it dry. We don't want saliva, bacteria underneath the filling. And so with the materials we're trying to get to and the ones I use, it's difficult sometimes in the very back of the mouth to keep it dry. And so for these dentists to always say this, and we're having a discussion, not an argument, but a discussion on this, I asked them at this point in time when they say this, I said, well, if you can put it in a wet environment, you're telling me that you've got saliva and bacteria underneath your filling. Aren't you telling me that your filling has failed from the very beginning? And if you didn't think it was failed, there's only one reason why. And I'm waiting for them to say it, is because they know the mercury's leaking out of the filling and it is killing the bacteria underneath it. And so after that, I get a lot of ugly looks and they tend to walk. The ADA has always said it's a safe product to use. It's got a great track record. So what are some of the national thoughts on amalgam? I've been very fortunate and I've been involved with some of the politics and I've been head of some committees and stuff, so I kind of knew the inside thoughts and what everybody was trying to do and what the states were trying to implement. And there are many documented mercury poisoning cases, and I'm going to show you one. The states, individual states, were actually trying to adopt consent forms. These are things every state was trying to do, and where I live, Alabama was one of them, where they were saying if a dentist uses amalgam, the patient was going to have to sign a consent form that says you were about to receive a product that contains mercury, a known poison, and go into this long spill, and the patient was going to have to sign it saying they were going to use it. No state has ever adopted that form, though. Every state is talking about developing amalgam restrictions, and so is the FDA. Basically, before it's all over, I think every dental office will have to have certain filters in their office that prevents any silver fillings or mercury that gets in our water lines from getting into the main public water lines. Again, all this is happening at the same time as the ABA and everybody else is trying to tell us that it's safe, but behind the